respected members of this elite audience, uh, respected Mrs. Cinder Joy, Deepa, Dr. Lelida Ramakrishnan, and the wonderful couple who are present, the Tommy couple who are present here with us. It's fashionable these days to begin with disclaimers, and I too begin my lecture with a disclaimer. I'm not an expert on death or anything related to death because I haven't experienced it myself. And for all the good things, I haven't gone through death to explain what it is and what it is. But I've only seen a lot of deaths happening in front of my eyes in my career as a neurosurgeon and as a doctor before. It is also important to thank Dr. Lelida Ramakrishnan for the kind words that she had uttered about me. But as they say, no man is a hero to his valet. I would also add that no man is a hero to his wife. The reason being that being a neurosurgeon, juggling with this organ transplant and brain death confirmation, the certification process has robbed a lot of good hours at home. And if you are to say all these things to my wife, I'm sure you will get a rude shock about me. Let me begin this lecture with defining death. We all have to go through death at some point of time. Most of us would have seen death happening around us, but then the clinical definition of death in medical terms can be either brain death or a circulatory death, what is called as the cardiac arrest. Cardiac arrest is the ultimate event that robs life from a body. The cardiac arrest is defined as lack of, loss of pulses, loss of heartbeat, loss of blood pressure, which means that your heart is no longer pumping blood, which means that the organs that require blood and oxygen and sugars meant for its sustenance is deprived of that, and therefore the human body dies with the organs dying. This is most of the times the last event that is recorded in our medical records. Cardiac arrest has happened and you are declared as dead. Now, the second thing that has happened in recent times, of course, is brain death. So how is brain death different from a circulatory death? Is in brain death, your brain fails to function, which means that your brain fails to drive the organs of your body. It is the brain which controls most of the organs in a subtle sense, in many key senses. But it sometimes, what happens is the brain fails to work anymore. You call that as a state of coma. Now, what is brain death in clinical terms is actually the brain stem, which includes three substructures: the midbrain, the pons, and the medulla oblongata, fails to drive the rest of the body, especially respiration. So brain death is when the brain fails to drive respiratory effort. The lungs cease to breathe. So what happens when the lung stops breathing? The oxygen does not reach the body. And when the oxygen does not reach the body for more than 3 minutes, the brain stops completely. All the organs undergo what is called as a shutdown. And this leads to a cardiac arrest secondarily. So thus, death can happen in two ways. One is circulatory death or the cardiac death, where there is no pulse, there is no blood flowing through your blood vessels, and therefore you are deemed as dead. The second second phenomenon is brain death, when your brain fails to work, your brainstem fails to work, and it fails to drive respiration. Because respiration is not there, you're deprived of oxygen, and therefore your rest of your organs shut down. Now, when does brain death happen? Brain death happens in a lot of conditions. Say, for example, you have suffered a horrendous road traffic accident, just as what happened to Mr. Jerry Verghese about a couple of weeks ago. Your brain is smashed, swollen up, the brain stops working. Sometimes what happens is the brain suffers from a catastrophic bleed, a rupture of a blood vessel in the brain, which leads to, cessation of all the activity. So a stroke in the form of a cessation of, the rupture of an artery leads to brain death. And the third situation where commonly brain death happens is when one of the main arteries to the brain gets choked. It fails to conduct blood right into the brain. And therefore, when the brain is deprived of blood because of the blockage of the arteries, there is a form of stroke called as ischemic stroke, and you become brain dead. Now, what happens when the brain death happens, as I have already described that. The next step, of course, is what has medical science done to sustain life? Two things have happened in recent times, which led to stopping brain death, leading to circulatory death. One is, of course, intensive care. As you know, 20 years ago, I'm sure nobody would have heard of intensivists. Now, every hospital has got intensivists who do their might to change the fortunes, the fate of many a patient who reach there. Intensive care is a specialty of its own, a subspecialization of medicine, which has made a difference to a lot of lives. Now, what happens is when a patient reaches an intensivist, he does everything to sustain life. He revives the heart, he gets the blood back into action flowing, but then many a times the brain does not heed to more than 3 minutes of cessation of blood flow, and you become brain dead. The second thing that has happened in recent times, in the last 30 to 40 years, is an equipment called as ventilator. What does the ventilator do to your body? The ventilator takes over your breathing, which means that when the brainstem or the medulla and the pons fail to drive respiration, the ventilator takes over, delivers oxygen, keeps the lungs inflated and deflated at the same rate as you would do when you breathe. That is about 14 times a minute. Oxygen and carbon dioxide exchange takes place. Your brain is not working, but your rest of your body is working. Your heart is beating autonomously. Your liver is working. Your intestines are working. Your kidneys are working, delivering urine out. Your excretory system, everything is working, but your brain is not working. So the one big machine which has led to this difference is the ventilator. Now, the problem is ventilator leads to sustaining life when life cannot be sustained. So the dilemma before a doctor is, how do you shut it off when a point of no return happens? Which means you're brain dead, you're unlikely to recover, but your organs are working. The greatest moral dilemma before a surgeon or before a doctor is, how do you shut off the ventilator? And it is at this point that a person becomes a candidate for organ donation. So brain death has to be, for the sake of organ donation, some events have to be there. The first event is you have to be in coma, which means that there is it's not reversible. You can be in coma if you take dosage of sleeping pills. You can just wake up from it without any problems. You can be in several other states of coma from which you can be brought back. There are certain coma mimic situations where the situation mimics coma, but it is not actually coma. I'll come to that later. Now, coma is a point when you lose awareness of what is happening, you fail to respond, and your brainstem fails to drive respiration. So this can happen when you have a road traffic accident and a head injury, or any form of head injury, or when you have a stroke in the form of a hemorrhage in the brain, or in the form of block in one of the big blood vessels delivering blood to the human brain. Now, the next stage, so now you have coma. The next stage is to put the patient through a series of neurological and other tests to confirm that the point of no return has reached. One of the important tests that we perform, which I performed in the evening, which is one reason why I got delayed by about 15 minutes, is a test called as apnea test. In apnea test, apnea means cessation of respiration. You have a patient who is in coma, whose brainstem has failed. It is not driving the respiration. So what you do is the ventilator is working. It is delivering oxygen to the body, to all the organs, hence all the other organs are working except the brain. Now, at this point, what you do is you disconnect the ventilator for about 10 minutes. And when that happens, the gas exchange between oxygen and carbon dioxide does not take place. And your carbon dioxide builds up, the oxygen comes down. Now, the carbon dioxide rise is actually a very potent stimulant for your brain. You raise the carbon dioxide to more than 60 millimeters of mercury, and then the brain gets kick-started if it is working. If it does not happen, that's when you say you're brain dead. Okay. Now there are certain, how do you declare somebody as brain dead? For the sake of organ donation, you need to have 4 doctors, 1 neurologist, 1 treating doctor, 1 head of the institution where this brain death takes place, and 1 from a panel of intensivists, neurosurgeons, and neurologists. So I have been working in this panel for the last 7 years. It has not been an easy job because the brain death certification for organ donation has to take place in twice. And each of this exercise takes about 45 minutes to 1 hour. And the 2 examinations have to be done at an interval of over 6 hours, which means that you do once now and the next thing after 6 hours. So and this panel has to meet, do all the tests, neurological tests, as well as this apnea test, and then declare that somebody is brain dead. Let me pause for a while. I will ask for any questions if there are any doubts at this point of time about brain death. Are there any questions from the audience? Let me just check the chat box. Please mute your mics. That's all. Okay, fine. All right. No questions. Shall I continue? Do I need to repeat any of the things which? So let me sum up what I said. There are 2 forms of death. One is from a medical perspective. One is circulatory death or a cardiac arrest, which is the last event. The second is, of course, the brain death, where the brain stops. The respiration is carried on, delivering oxygen with the help of ventilator in an intensive care. Okay. Now, let me, when people have a lot of doubts about coma, there are different variants of coma. In this case, for brain death, you need to have a ventilator supporting your respiration. Now, there is another form of coma called as persistent vegetative state. I'm sure at least a few members of this audience would have known about this case called as Aruna Schonbach. Aruna Schonbach was a 22-year-old beautiful nurse who was working in King Edward Memorial Hospital in Bombay in the 1970s. One day, when she came to duty, she went to the basement of the wards where lab experiments are carried out on dogs. Many physiological experiments are done on dogs for the sake of medical research. She went there to change her clothes, but unfortunately for her, there was a man waiting for her who attacked her, tried to rape her, throttled her with a chain, a dog chain. And when she got strangulated, she went into coma. The surgeons in KEM Medical College Hospital revived her. But unfortunately, she remained in what is called as persistent vegetative state for 42 long years. She survived only because of the excellent care given by her fellow professionals in King Edward Memorial Hospital. She died in 2015 after 42 long years of persistent vegetative state, which means she had lost all awareness of what was happening around her. She did not respond to any of the stimuli that you're giving her, but her digestion, sleep-wake cycles, and heart worked very well, apart from her respiration. Her cognitive functions had all gone. Only her respiratory and other vegetative functions persist. Now, this is not a condition where an organ donation can be done. Organ donation happens only when your respiration fails. You're not able to breathe. Your brain shuts down your respiration, and that respiration shutdown leads to oxygen deficiency and therefore then subsequently death. Okay. So now I have outlined what coma and brain death is about. There are a few other variants also. I'm not going into too much of neurology because neurology can put anybody to sleep. Now, what are the organs that you can donate from a brain dead donor? All of us can donate our eyes, irrespective of the way we die. Unless we have an infection or problem in the eye, it shouldn't be a problem. Any age you can give your eyes. But the other organs can be donated only if you are brain dead without an infection or without a malignancy. If you have a malignancy, if you have a cancer tumor rummaging through your body, 1 minute, just a minute, excuse me. So I was at, where was I? I'm sorry.
You were talking about somebody having a malignancy.
Yeah. Oh, okay. Who can donate the organs? Okay. You're not a candidate for brain organ donation if you have an infection or if you have a gross malignancy, except a brain tumor, because a brain tumor seldom spreads outside your brain. So your organs are intact, only the brain doesn't function. So you can, so this, it is at this point, you know, if you don't have an infection, if you don't have a malignancy, and if you're brain dead, that is when you can donate your organs. Now, most of us at the end of this lecture, and after listening to Mrs. and Mr. Roy, would be happy to donate organs. Now, organs can be donated in two conditions. One is live donor, as it happened with this couple, wonderful couple here, or from brain dead donors. So what are the organs that a live donor can give? Any donor, a live donor, can give his kidney or a part of the liver. Any donor can give blood, which is also a very important contribution to sustaining life of our fellow beings. Now, we come to brain dead donors. What can a brain dead donor give to his fellow human beings? He can give 2 of his kidneys. He can give his liver. He can give his pancreas. He can give his lung. He can give his hands and skin. And apart from that, anybody can give their 2 of their eyes. So in the normal process, you know, if you look at Mr. Jerry Verghese' cases, about 5 people benefited out of it. The heart valve is right now in Sri Chitra. We are waiting for a right recipient to come in. It is kept in cold storage. It will be used as soon as a right recipient comes who matches in every way. So how do you, so you can give, you can, in any case, in every case of brain death, you have a potential to help 10 living people. So, but then unfortunately what happens is most of us would express our desire to donate our organs. But when we are brain dead, we are not able to convey this to the treating doctors. So it is our kin who should be coming forward to tell the doctors who are treating that my so-and-so who is under your treatment, who is now brain dead, should be considered as an organ donor. Now, what happens is, in Kerala, there are 14 districts, and every day at least 1 brain death gets recorded, a minimum of. Unfortunately, only less than 1% results in transplantation, organ donation and transplantation. Why is this so? The reason is simple. When it is my father who is hooked up to the ventilator, who is about to die, the doctor comes and tells you, sir, this is a point, there is no return. There are no comebacks. people lose themselves to their grief, that they forget what their father or mother or somebody close to them has told them. They just are so emotional that even doctors would not come forward to broach the subject of organ donation. This mindset should change. If we are able to change our mindsets about organ donation, that is, even at the height of our griefs, if we can come forward and donate a part of our loved one's body to someone else so that they can sustain their life, you have made a difference to the world. So the mere statement that I'm going to donate my organs after my death will not work. There should be an executor who should come forward and say that my dear one, my dear and near, who has already promised his organs, must be considered for organ donation. So, dear friends, dear dignitaries, please come forward, even at the height of your grief, to donate your organs, your loved one's organ, so that someone else can have an extra day's life. I'm sure I will quote a few examples of how things have changed. You will recall Mr. Jerry Verghese, who had a very bad head injury on the last days of last month. He was brought to medical college, and from there he was shifted to Kerala SCTIMST hospital, where I was called to declare him as brain dead. After all the certification process, his wife, who's in her late 20s with a kid, 2-year-old kid, had the courage to tell us that my husband used to say that we should benefit people around us, even when we die. And she came forward bravely, even at the height of her grief, to donate her husband's organs. I'm sure you would have forgotten a person called as Matthew Achard. Matthew Achard was an auto driver in somewhere in central part, in the eastern part of Kerala, in the hills. He was an auto driver who had developed a cardiac failure. He could not even walk 10 meters without having to stop for catching his breath because his heart was not pumping enough. In 2015, a leading lawyer of the Trivandrum bar, Advocate Neelakanta Sharma, suffered a catastrophic hemorrhage in his brain. He was brought to Sri Chitra, where he was operated upon. Unfortunately, by the second day, we knew that he had reached a point of no return. His wife, who was working in the agriculture department, came forward and said, "Please donate my husband's organs." So the heart was actually transported to Lisi Hospital, where Jose Chaco Periyapuram, renowned cardiac surgeon, transplanted the heart onto Mr. Matthew Achard. It's almost 5-6 years now. Achard still lives. Many a times, people say that even if you receive the organs, you're not going to live long. But then, being operating brain tumors for the last 20 years, almost 19 years, I must say that people come and plead for a month's life, for a week's life, and for a few days' life. The most precious thing in this world is, of course, life. A message that I want to give, apart from exhorting you to donate your dear one's organs, is that don't do anything to destroy yourself. Because if you smoke, if you drink, and if you do all those addictions which harm you, you are destroying the most precious asset that you have, that is your good health. Now, let me come to the controversies that are surrounded brain death, because it is not, in a state like Kerala, whatever you do, people liked controversies. Back in 2017, there was a public interest litigation which was filed by a doctor from Kollam called Dr. Ganapathy against the practices in Kerala of how a brain death is declared and organ donation takes place. His contention was that we do not have a good protocol in our state for declaring brain death. Now, my job was to convince the judges. I think it was Sri Vijay Raghavan and Navneet Prasad, the Chief Justice, who were present in the court, who heard my deposition, which went on for 3 hours. And at the end of the day, they said, all the rules and regulations laid down by the government of Kerala for declaring brainstem failure and or brain deaths is all right. Nothing is wrong. Unfortunately, there has been a few controversies which have led a little bit of, dimmed the glow around the organ donation. The reason for this controversy is because, people claim, like a movie, that doctors inflict injuries on the patient, make them brain dead, and donate the organs. This is not true, at least in Kerala. Of course, there have been instances when children have been kidnapped for their kidneys and other organs. But then brain death and subsequent this thing has not taken place in Kerala. I have been associated with this brain death certification for the last 7 years. And I know most of my colleagues who are working in this field, all of them, are very credible that they would not declare somebody as brain dead without going through a rigorous investigation process, including neurological and other tests. One of the movies which I had seen about 3 years ago, talks about sustaining a head injury, inflicting a head injury, and therefore and you end up in an emergency room where you're brain dead. I have not encountered anybody who is so good enough to deliver a blow which renders a person only brain dead and not exactly dead. If you get a blow on the back of your brain, as it is seen in that movie, shown in that movie, and you are brain dead, if you are not breathing for more than 3 minutes, all your organs start shutting down. There's no way you can be a potential organ donor. You're dead. So the basic premise of that movie was wrong, but unfortunately, it gave a message among the common people that there is something wrong with organ donation because of the profits and other motives that are attached to it. Now, what has the government of Kerala done to contain this criticism? The government of Kerala has made a rule that the kidneys, at least one of them, will go to a government hospital. So all the government medical colleges in Kerala are doing renal transplant. Many a poor patient who has been on dialysis for several years has benefited out of this brain death and organ donation program from government medical colleges. The government of Kerala also started a liver transplant program in Medical College Trivandrum. Unfortunately, because of certain technical issues, it could not be sustained. But there is a renewed interest in this. The government is taking measures to ensure that liver transplant takes place at least in 2 of the hospitals under the government. So we should be seeing more of such expensive transplants in the government sector, which should at least silence the critics about this. Now, how does one get an organ? Supposing I am having renal failure, I'm having both my kidneys have failed and I'm on dialysis. What I have to do is I have to register with an organization called as Kerala Network for Organ Sharing, which is under the Director of Medical Education, Government of Kerala. You register yourself, you enter your blood group and other things, where you're from, and you enter a queue. The moment a brain death happens, they match your blood group. If the blood group is matching, they do other tests to find out tissue compatibility and then take you up for receiving the organ. You must understand that every day in every district, close to 300 people will be receiving dialysis. There are a lot of patients who are waiting for organs. Unless people who are alive and well come forward to donate a part of their body, at least when they die, we will be able to make a difference for these people. Now, how much time have I taken? Have I put people to sleep? Can I continue?
Yes, please do continue.
Okay. Now, what can you do to be an organ donor? You state your intention to the people around you, so that in case if you're brain dead, I want to donate my kidneys and liver and all the other organs. In case if you are more than 70 plus, and if you are having conditions which prevent you from being an organ donor, you can at least donate your eyes, 2 pair of eyes. Now, there is a misconception amongst people that donating the eye means they will gouge your eyes out and you will be left with nothing in your eye socket. No, that is not the case. What they take out is only the cornea, a membrane which is about less than a millimeter from the surface. There are absolutely no cosmetic changes. And this cornea will go to a hospital where it will be transplanted to people who have got opaque corneas so that their vision is restored. Even if the vision is not restored, many people who have got a cosmetic problem with one eye remaining opaque and therefore have social handicaps will have a good cosmetic outcome with the donation of your eye, which you are not going to use. You must understand that all these things either get burned or get eaten up by bacteria and other organisms when buried in the sand. So instead of becoming victims of the bacteria and the worms and other things, or victims of a fire, please come forward to donate at least a few of your organs to others. Now, once you have declared, there is no formal process of it. The moment you enter into an ICU, there are people who carry cards saying that I want to be an organ donor. So the doctor will respect that, but then the permission, the consent for organ donation has to come from the dear and near ones. It is here that we should wake up. When somebody close to us is on a ventilator, is declared as brain dead, please come forward. The organs that are there on ventilator will become dust in a few days' time. Why not let it get implanted in some other human being? And therefore, that person can sustain his life. Matthew Achardan is a classic case where he was expected to die within 6 months when the transplant did not take place. And when the transplant did take place, he has lived for 6 long years. So this is where you can make a difference. Have I crossed the time limit that you have set for me?
It's fine. You can continue, please.
Okay. I'm sure that I have nothing more to say. I would rather listen to people, especially their queries about brain death and organ donation and brain death certification. Remember, there is a wonderful line which is there in my anatomy dissection hall in medical college, where we have the cadavers, that is the dead bodies are kept for us to learn. This is where death delights to help the living. This is where death delights to help the living. We know that we cannot beat death. One day, all of us have to face the phenomenon called as death, about which we don't know much. So when it happens, let there be a little bit of happiness in it by donating our organs to others. I'm happy to address questions, any number of questions on this topic. The reason why I stopped at the end of 20 minutes was the human concentration span is 20 minutes. And even the best neurosurgeon can put people to sleep.
Thank you, sir.
Thank you, Dr. EASWER. Now the session is open to questions. You can ask any and every doubt you have on this topic, and you have the most adept person here to answer. So Juhi has asked a question, is there in the chat box. How do we register for organ donation?
There is no formal registration process. Karnataka government has introduced a card, that is your driving license, where you add the point that I'm a potential organ donor, like that. There are many times, I get, a lot of patients who came to my outpatient clinic, at least 3 patients who came to my outpatient clinic after last Sunday, came with papers saying that I want to be an organ donor. Well, there are no formal organizations which receive such this thing. Many government, Kerala Network of Organ Sharing definitely collects all this thing, but then they are not in touch with these people when they are brain dead. So the people who have to do this, have to declare in a written format or verbally to your dear and near ones that I want to donate my eyes when I die. I want to donate my kidneys if I am brain dead. I want to donate my liver if I am brain dead. That is how, and then the person who is next to his kin will have to come forward and sign the forms when somebody is brain dead. When my father is brain dead, I have to come forward and say, I want to donate his organs, and I will sign all the forms. This is how the system works. There's no formal, identification, list of people who want to donate their organs. No, there is nothing like that, because you will never know when, a disease strikes you and renders you brain dead.
Thank you, Dr. EASWER. I had a question. That is, when you say near the kith and kin, has there been any situation where there's a legal complication because one person says yes and then it becomes another, issue for the family or for the doctor even? Is there any such situation?
At least in my practice, in the last 7 years, I have not experienced. But there are situations where, one member of the family, especially I heard it happened in Chennai, where one member of the family wanted to donate. The other members didn't want to cut open the body and things like that. That was their contention. But this happens only if there is a consensus in the family. You cannot, because one of the things which doctors fear is litigation later. I declare somebody as brain dead, and I broach the idea of organ donation. One son says yes, and another son in US says no. 6 months later, the second son comes in and says, "Why did you steal my father's organs?" The last thing that doctors want is controversies, especially legal controversies. No, we usually do the organ donation process only if everybody agrees to it.
Doctor, once you've transplanted and the organ from the donor to the patient, is there any possibility that the body may reject it? Is there any possibility, or the body accepts it?
Yeah, how it works. Let me give you a bird's eye view of how the recipient reacts. There are 2 matching processes, which is usually done in all transplant. One is your blood group matching. Now, O positive donor means the O positive recipient. A positive donor means A positive recipient. This is the common this thing. The second thing is there is an antigen called as HLA, human leukocyte antigen. HLA is if your HLA match, that's when you are the best recipient. If, for example, if I am donating my organs to Mr. X and Mr. X HLA matches with me, and then Mr. X is a good recipient. Now, what happens is when you donate your organs, your body launches an antibody response. For the body, this is a foreign body, like a virus, like a bacteria, or anything. So the body launches a full-scale attack against the organ which has been implanted in you. 1 minute, there is some noise in the background. Let me just close the door and come. Sorry. Okay, so how do you prevent the body from rejecting an organ? What you have to do is you have to suppress the immunity. The immune system fights anything that is kept inside your body. So this is done with special drugs most common one is steroids. And there are many other drugs which are meant to prevent an immune system from launching an attack on the organs which has been transplanted. And this goes on for several years. This is how you prevent a rejection of an organ which is transplanted